Vaccinate now against poliomyelitis. This is the advice given to all adults by the March of Dimes. Polio is no longer a children's disease. It strikes unprotected adults up to 50 years of age. When polio strikes the breadwinner or the mother, it affects the lives of the whole family, and recovery at best is a long, painful, and costly process. Why take such a risk when protection is as close as your telephone? Pick up the phone now and call your doctor. Make a definite appointment for your polio vaccination. 3 inoculations give adequate protection, 1 now, 1 a month from now, and the third 5 to 7 months later. It takes 6 to 8 months to become fully protected. The vaccine itself is free. You pay only the doctor's fee for the office call. Take the advice given to you by the March of Dimes. Call your doctor now and be as safe as the children when polio strikes this year.
The polio virus is a single plus-stranded picoRNA virus that is non-enveloped. It is a simple yet stable virus consisting of a genome surrounded by an icosahedral capsid. The virus attaches to the human polio virus receptors, or PVRs, on the nasopharynx and intestines. It creates a pore on the surface of the host cell, and the genome enters and multiplies within the host cell. The cell dies and releases up to 10,000 new poliovirons per cell. If the virons penetrate the intestinal lining, they enter the bloodstream. This is called viremia. If viremia continues, the virus can attach to receptors on the anterior horn cells of the spinal cord, attacking the nerve cells.
95% of all polio infections are asymptomatic. However, signs and symptoms of polio can include upper respiratory tract infection, sore throat, fever, nausea and vomiting, abdominal pain, constipation, fatigue, occasionally diarrhea, and flu-like symptoms. Additional symptoms may include meningitis, loss of superficial reflexes, increased deep tendon reflexes, and severe muscle aches and spasms in the limbs or back. Fewer than 1% of polio infections result in paralysis. Diagnosis is confirmed by throat secretions, stool samples, or cerebrospinal fluid. Treatment includes bed rest, portable oxygen, pain relievers, and physical therapy. There is no cure for polio. The only way to prevent polio is through vaccination. There are 2 types of vaccinations: inactivated poliovirus vaccine, or IPV, and oral poliovirus vaccine, or OPV. IPV is the only vaccine used in the U.S. since 2000. It is 99% effective and is given as a shot. OPV is used globally for eradication efforts. It is 95% effective and is given orally. The IPV vaccine is given as a series of 4 shots. The first one at 2 months of age, then 4 months, 6 to 8 months, and 4 to 6 years. The schedule for adults is a bit more complicated. For unvaccinated adults, it is recommended to receive 2 doses, 1 to 2 months apart, and a 3rd dose given 6 to 12 months after the 2nd dose. Adults who have not completed the series should be given the remaining doses of IPV. For adults already vaccinated who are traveling or at increased risk of exposure to polio, a one-time booster is recommended.
Person-to-person spread of poliovirus via the fecal-oral route is the primary route of transmission. Poliovirus infection typically peaks in the summer months in temperate climates. Poliovirus is highly infectious with seroconversion rates among susceptible household contacts of children nearly 100% and greater than 90% among susceptible household contacts of adults. Persons infected with poliovirus are most infectious from 7 to 10 days before and after the onset of symptoms, but poliovirus may be present in the stool from 3 to 6 weeks. At one time, poliovirus infection occurred throughout the world. Transmission of wild poliovirus was interrupted in the United States in 1979. A polio eradication program conducted by the Pan American Health Organization led to elimination of polio in the Western Hemisphere in 1991. In 1988, the World Health Assembly adopted the goal of global eradication of poliovirus by the year 2000. Although this goal was not achieved, substantial progress has been made. One type of poliovirus appears to have already been eradicated. In 1988, an estimated 350,000 cases of paralytic polio occurred, and the disease was an endemic in more than 125 countries. By 2006, fewer than 2,000 cases were reported globally, a reduction of more than 99% from 1988. Thanks to global action of organizations like WHO, UNICEF, CDC, and Rotary International, poliovirus cases have been dramatically eliminated.